In your mind, when you were trying to decide how to set these therapists up to do really good work with the patients, what was sort of like the checklist that you have going on? Like, if someone comes to me for, let's say, OCD or panic treatment, I kind of know what I want to make sure that, what psychoeducation I want to give them, and like how I want to go about this process. And it's not necessarily even a specific modality. It's just kind of like the psychoeducation or the philosophy that I want to like instill in them. So I guess I was kind of more curious about that angle instead of any specific modality. Does that make sense? What I'm even
totally.
saying?
Yeah. Yeah, I did want to provide a lot of psychoed to our therapists around what the experience of an eating disorder is like. I think there's a ton of information people can get about statistics or whatever, but it's different than thinking about like what are our patients actively thinking about and feeling on the day-to-day, what's driving their decision making. So that was really important for me to give them insight into the experience of the illness. It's also a way to have a ton of compassion for what our population is struggling with.
Can I interrupt you for a second?
Yeah.
I was just thinking that like one of my favorite moments sometimes in the therapy room is when the patients get the impression that like I'm reading their mind, because I say like, I could imagine that anxiety might be saying this right now, or when you're in this situation, they're like, oh my God, how did you know? Like, how did you know that? And I guess that's sort of the vibe I was getting from you when you were talking about why you really want them to understand what their experience might be like.
Exactly, so that they can convey to patients, first of all, they can understand and sort of anticipate where things might be going, right? But so that they can convey to patients like a deep understanding of the experience, because I think, I had a patient yesterday tell me, are you in my head? Like how did you go there? How did you know?